Recently, we've seen a lot of media coverage talking about how there is new data that apparently shows that abortions have increased since the overturning of Roe v. Wade. Abortions increased in the U.S. overall in the year post-Dobbs. Despite state bans, legal abortions didn't fall nationwide. U.S. abortion rates rise post-Roe. They're saying the total number of abortions increased from the year before Dobbs to the year after Dobbs. What does that mean? Does it mean that abortion bans or abortion restrictions don't make any difference? Does it mean that the people who claim to want to decrease abortions are wasting their time if they focus on policy changes? No, it doesn't mean that at all. So the data they're talking about is from a report from the We Count project. It's a data analysis project where they contact as many abortion providers as they possibly can and ask them to report how many abortions they've been providing month to month. They found that in the years since the Dobbs decision, there were 2,200 cumulative more abortions nationwide. They don't report that total as a percentage, but CDC has estimated a little over 600,000 abortions in the country nationwide. Guttmacher has estimated more like 900,000, depending on how you calculate it. That would be an increase between 0.2 and 0.4%. Before we even talk about anything else, it's important to note, and they talk about this in the report, that abortion has been increasing in the U.S. since 2017. More specifically, the Guttmacher Institute reports that abortion had increased 8% from 2017 to 2020. But right away, if you had abortion increasing by 8% in recent years, and then now they're saying it increased by 0.2 to 0.4%, you can see a huge difference. We Count emphasizes that this extremely minimal national change masks huge changes state by state. The states that passed bans or restrictions saw major decreases in abortion, while there were other states that We Count refers to as surge states that saw huge increases in abortion. Notably, it wasn't necessarily pro-choice states that saw huge increases in abortion, although there were some like that, such as California and Illinois. But it was also states that bordered states with bans and therefore were easier to travel to, such as North Carolina and Florida. That's significant because the We Count report is looking at abortions up until June of 2023. Guttmacher has a report from October of 2023 talking about how North Carolina passed a 12-week gestational limit and has already seen a 31% decrease in abortions. Florida is a bigger unknown as they wait for their state Supreme Court to decide on a 15-week ban, and meanwhile Governor DeSantis already signed a 6-week ban, and meanwhile there are pro-choice groups who are trying to enshrine the right to abortion into the Constitution next year, so it's all kind of up in the air. Suffice to say, some of these states that We Count refers to as important access points either have already passed limitations since this report ended or have planned to pass limitations going forward. Meanwhile, We Count also emphasizes that the estimates they use to figure out pre-Dobbs numbers might be major underestimates. For example, Texas passed their heartbeat law in September of 2021. By the time We Count calculated pre-Dobbs numbers, which was in April and May of 2022, Texas had already seen substantial decreases in abortions. They had the same kind of thing in Oklahoma, where they had already closed several abortion clinics in the state and then passed a ban in the state by May of 2022, before Dobbs even happened. On the other hand, the We Count report only includes formal healthcare setting abortions that were done with some kind of clinician oversight. So it doesn't include illegally mailed abortion pills, which is going to be a major factor. These are only some of several factors that the report can't account for. And they're upfront about this. If you read the report, they talk about the limitations on the data. But that's kind of the point. It's always difficult to measure exact abortion numbers, especially if we are also talking about illegal abortion. This is pushback we've gotten many times when people talk about how there's no way for you to know for sure if restrictions are working. These difficulties in measurement are exactly why it's so important to look at live birth data. People can have secret abortions. It's very hard to measure, but they can't have secret births. There's been a lot of research over decades that finds that when you restrict abortions, at least initially, birth rates go up. You can see a lot more of that research at this URL. And we've also already seen that phenomenon in terms of Texas heartbeat law. The research this headline is based off of included confounding factors like changes in immigration and the organic changes in birth rates they were going to expect in the state otherwise. They are very specifically saying that there were 10,000 more births than expected, and they think it's because of the heartbeat law. So if you're wondering whether abortion restrictions on aggregate, in total, decrease abortions, they do.